It is with immense pride and a deep sense of purpose that we prepare to host the World Health Summit regional meeting right here in Nairobi, Kenya, from the 27th to the 29th of April 2026. Hosting this summit is not merely a diplomatic milestone for Kenya. It is the profound validation of the journey we are undertaking together to transform health outcomes for our people. When the world gathers in Nairobi, they will not just be discussing the future of global health. They will be standing on the very soil where that future is being built. We are currently navigating a historic transition in our national health financing mechanisms through the rollout of the new Social Health Authority. And for us, the summit's dedicated track on health, workforce, financing, and system building is deeply resonant. Sessions exploring the financing of universal health coverage through domestic resource mobilization reflect the exact realities we are grappling with and solving on a daily basis. We are transitioning away from fragmented, out-of-pocket systems towards sustainable investments that ensure no Kenyan is left behind. But financing alone cannot deliver care. Care is delivered by people. Kenya has aggressively prioritized strengthening our policy frameworks for human resources for health. We know that expanding our health workforce, aligning their specialized training with true population needs, and fiercely guarding their retention across both public and private sectors is the bedrock of our health system. This summit will shine a necessary light on these very professionals, exploring vital intersections like digital innovations for health workforce, capacity building, and by empowering our healthcare workers, we empower our communities. Furthermore, we live in an era of polycrisis where the environment and human health are intertwined. The summit's focus on pandemic preparedness and health security in Africa is not an abstract concept for us. We have seen firsthand how emerging public health threats such as dengue fever challenge our development. These threats have taught us a critical lesson that we can no longer rely on reactive outbreak responses. We must champion an anticipatory, integrated One Health framework. Health security requires us to break down silos between human, animal, and environmental health sectors, and that is to allow forging a unified defense. The World Health Summit in Nairobi will be a crucible for innovation. It is where global partnerships, including those between Africa, Europe, and brilliant international health organizations, will meet local community-driven realities. We will discuss everything from primary healthcare and digital AI to the very social determinants that dictate the quality of life for our most vulnerable populations. The summit is important for Kenya because it mirrors our highest ambitions. But Kenya is also important to this summit. We offer the world a living laboratory of resilience, a blueprint for proactive health security, and a testament to what happens when political will meets grassroots engagement. Let us use this historic gathering in April not just to talk about the global health architecture, but to actively lay its new foundation. Thank you, and we look forward to welcoming the world to Kenya. My name is Mary Muthoni. I am the Principal Secretary for Public Health and Professional Standards.